First tip that I want to share with you is a exercise that you can do to improve your knowledge of pharmacology. And although different students learn different ways, some students are more auditory, they learn more by listening than writing. Always writing is beneficial for you. So a tip that I think that is going to make a huge difference on your memorization, because remember, a lot of pharmacology deals with memory. The more you write, the better the easier it is to recognize certain concepts. And I know that some students don't like writing. I am one of them. I hate writing. As a matter of fact, I see students that have like notebooks and notebooks and notebooks of written information, and I always ask them, when was the last time that you reviewed it? So if you're not going to review it, don't waste your time writing it. But in this scenario, you're going to create what is called medication or drug cards. And you could say, well, professor, I know that on Amazon or I know this company that sells already made pharmacology cards. Why don't I just buy that and learn it? Well, that is a way that you can do it. But if you decide to write it yourself, it's going to be more beneficial. Now, I understand that it's going to take more time in order to make those cards. But remember, we're talking about what can you do to make it better. If you write it, the process of deciding, reading the information and saying, okay, I'm going to put this information here. No, this information is too long. I don't want to include that in the card. That's going to help you remember a lot of information. So this first tip, creating your medication card, it is beneficial for you to remember. I'm going to give you an example. Let's use digoxin as an example. Example number one. Let's say you create a card that says digoxin. And on the back of the card, you can put the classification of this medication, which is a cardiac glycoside. You can put the medication is administered, or the patients that I will be administering this medication is for patients who have congestive heart failure or rapid atrial fibrillation, or atrial fibrillation with a rapid ventricular response. The cardiac glycoside increases the contractility of the heart and decreases the heart rate. In heart failure, this medication is administered to increase the contractility of the heart, but in atrial fibrillation, the reason why the medication is administered is to decrease or slow the heart rate. Make sure every time you include information about a medication, include nursing interventions and drug-to-drug interactions. Why? Why this is important? Because many of the pharmacology NCLEX questions deal with nursing intervention. So yes, it is great to know the intended effect of the medication. It is great to know why you're giving the medication or their purpose for administering the medication. But most of the NCLEX style question deals with nursing interventions, identifying if the patient has a side effect, an adverse effect, and actions that you can do as a nurse whenever you see complications of medication administration. And other questions deal with prevention of complications once we decide to administer XYZ medication. Drug-to-drug interaction is extremely important. Also, if the patient is taking over-the-counter medication, the teaching behind the over-the-counter medication and how it can interact with a prescribed medication. A lot of questions on the NCLEX related to this, and also herbal remedies and how herbal remedies can interact with a prescribed medication. So anytime you're using a pharmacology book, you're using the Saunders, Pearson, Kaplan book, or whatever resource that you're using and you're studying pharmacology, make sure that you include nursing interventions and drug-to-drug interaction. Extremely important. This is an example of how the drug card can look. For example, on the front of the card, you can put the classification of the drug. You can put the action drug uses, nursing implication, and what are the important nursing interactions that you will be following for that specific category drug or medication. And then on the back of the card, you can include side effects, teaching needs, drug names, etc. So there are different ways that you can use this tip, making the pharmacology drug cards. You do something that works for you. Remember, things work differently for different students. I am just giving you some ideas to improve and have a higher chance to memorize and really learn pharmacology for your nursing school and also when you're preparing for the NCLEX. One way that I like to learn pharmacology is that I organize the medication by categories. Let's say, for example, that I want to study hypertensive medications or antihypertensive drugs. For example, many students like to put drugs together and they are disorganized. Remember that the more disorganized that you are, the worse it is to study pharmacology. Don't make it harder than what it already is. Pharmacology is very difficult, but if you're not organized, it's going to be worse. So if you're studying medications to treat hypertension, you know that there are several subcategories. For example, in the screen you have the angiotensin converting enzyme inhibitors or the ACE inhibitors. But you also have beta blockers. You also have calcium channel blockers. Remember that although they help with a patient with hypertension, they do not work the same way. The mechanism of action is different, and you have to know those mechanisms of action. Another tip that I can suggest is learn specific classifications of medication, including the mechanism of action, the side effect, and adverse effect. I will tell you this, okay? Unfortunately, I have seen many nursing books making a big mistake. And the mistake is that they put side effects and adverse effects together. They are similar, but are not the same. A side effect and an adverse effect is not the same thing. And you, as a nurse, you need to differentiate between side effects and adverse effects. As a matter of fact, you will see questions on the NCLEX that says, which of the following are side effects of XYZ medication? Which of the following are adverse effects of XYZ medication? So you need to know the difference. And when you're using different resources, sometimes they put it together and you don't know. So which one is a side effect? Which one is an adverse effect? In today's training, you will learn the exact difference between the intended effect, the side effect, and the adverse effect. Let's use, for example, a beta blocker, okay? You need to identify medications and the specific class that this medication represents. And also, you have to learn safety requirements that are related to that category. For example, when we're studying beta blockers, remember that it is an important safety nursing action to check the blood pressure and the apical pulse. Why? It is a safety measure. Why is that a safety measure? Because beta blockers will reduce the blood pressure, specifically the heart rate. So before you administer the medication, part of your assessment is to assess the blood pressure and to assess the apical pulse. But at the same time, if you're teaching a patient, you're doing discharge teaching about when the patient is going to take beta blocker medication at home, let's say metoprolol, we have to include in the teaching that the patient needs to check the blood pressure, but also check now the radial pulse, not the apical pulse, because as nurses, we check the apical pulse or apical pulse, but we teach the patient to check the radial pulse. So you see, this teaching is important. Whenever you see a specific teaching for a specific category or a specific medication that applies to that specific group, write it on your drug card, because this is going to be beneficial when you're answering pharmacology questions, whether it is a prioritization question or a select all that apply. A good change happened several years ago. Now, the NCLEX question will only include the generic name, not the brand name. I don't know how nursing students did it in the past, because in the past you had to know both the generic and brand name. What is the problem with that story? That there are numerous brand names for one generic name. Thanks God for the NCLEX now, all you have to learn are classifications and the specific generic names for each one of these drugs. And if you use prefix and suffixes, it will help you remember those categories. So if I were you, I would create a list of prefixes and suffixes that you can use to remember certain medications category. Now, the next tip that I want to include in this training is when you're analyzing a pharmacology question and any question in general, part of the 5 key factors of an NCLEX question is to determine who your patient is. Is your patient an adult? Is your patient a pediatric patient? Is your patient a female or a male? Is your patient pregnant? Is your patient breastfeeding? So who is your patient? And I want to dedicate or focus your attention on pediatric clients, pediatric patients. You need to be aware that medications affect differently a pediatric patient than an adult. It is known that when you are administering fluids to a pediatric patient, there are certain safety precautions that need to be taken in consideration. Why? Because a pediatric patient, in comparison to an adult patient, has a higher risk of fluid volume overload, and at the same time has a higher risk for dehydration. So when you're dealing with a pediatric patient, be specific on who your patient is and what is the medication that you are administering. For example, the weight of the child, the weight of the pediatric patient, it is used frequently to determine the dosage for the medication and whether it's going to be safe or unsafe. So part of pharmacology on the NCLEX deals with dosage calculation. And there is a video in our training on our YouTube channel where I teach you guys how to do dosage calculation with the dimensional analysis. If you haven't seen that video yet, make sure you find it here on our NCLEX Crusade International channel. I'm going to put a note here also so you can see it and find it later on. Well, dosage calculation, you're going to do a lot of dosage calculation maybe on your NCLEX to adult and pediatric patients. And remember that most of the medications for pediatric patients are prescribed in milligrams per kilogram. But the NCLEX makes it difficult, and they can give you the weight of the patient in pounds and not kilogram. So in those scenarios, you have to do a conversion factor, and you have to convert pounds to kilogram. Remember that 1 kilogram, it is equal to 2.2 pounds. An easy way to remember this is, if you're trying to lose weight, I love my weight in kilogram because it is smaller. I weigh more in pounds than in kilograms. Of course, it weighs the same. It's just a different measuring unit, but it's just for you to memorize that 1 kilogram, a smaller number, equals 2.2 pounds, a bigger number. All right? So there could be questions on pharmacology for pediatric patients where you have to identify if that is a safe dose or not. They might give you a therapeutic range, and you have to identify if the dosage that you have in front of you is in the therapeutic range of that specific medication for that specific patient. When we talked about elderly clients, similar concept. Elderly clients are also a higher risk for drug toxicity, adverse effect. As you know, the body has aged, the different organs are not working as perfect as it was working before. The patient can develop hepatotoxicity and nephrotoxicity sooner depending on the medication. Also remember that a lot of the elderly patients have polypharmacals, meaning that they take a lot of medications usually at the same time, and there's always that risk of medication to medication interaction. So the nurse needs to be aware of how the elderly client can have a higher risk for safety, higher risk of toxicity, higher risk of falls. So a lot of that critical thinking for the NCLEX. Remember that you have to identify that certain laboratories needs to be monitored. For example, if we're giving the patient certain diuretics, we have to monitor for electrolyte imbalance and so on. The elderly patient, it is a very a client that you need to be very, very careful. The extremes, elderly or the pediatric patients, specifically the newborns and the infants. The infants is very important. A lot of questions about infants, okay? And then lastly, I wanted to share about pharmacology and female patients, okay? Female patients that are either pregnant in the first, second, or third trimester, female patients that are breastfeeding. Whenever you see on an NCLEX question, here we have a female client that is primipara or primigravida, is telling you that this female is in the second trimester or third trimester or first trimester. You have to recognize, why is it telling me that this patient is pregnant and in the first, second, or third trimester? Remember that some medications are teratogenic, meaning that it can cause damage to the fetus, harm to the fetus. So whenever you see medication and pregnancy, is usually the question is related to an effect of the medication and the harm that it could do to the developing fetus. The same way with a mother that is breastfeeding. You see breastfeeding, you see a medication, think, what is the safety problem here? What is the interaction between the medication and the female that is breastfeeding? Keep that as an important factor to determine, okay?